Every year, millions of seniors go to their doctor, thinking a routine checkup is just another box to check off, no big deal. But what if that checkup wasn't as harmless as you thought? What if I told you that some of the most common medical tests you've probably had yourself might actually increase your risk of stroke, sometimes within just 72 hours? It sounds hard to believe, right? You trust your doctor. You follow every instruction. But inside the fine print of modern medicine, there are risks no one is talking about. Until now. Hi, I'm Dr. Maria from Senior Health Boost, and in this video, I'm going to reveal what the brochures don't tell you, what the nightly news won't cover, and what even your doctor might not realize, especially when you're over 60. Let me ask you this. Have you ever walked out of an annual checkup feeling relieved, only to experience dizziness, blurred vision, or even strange heart palpitations just a few days later? If so, you're not alone and you're not imagining things. The truth is, certain routine medical tests, especially when repeated too often or done without proper preparation, can silently disrupt blood pressure, strain your heart, and even trigger a cascade of events that increase your stroke risk. Now, don't worry, this isn't about fear. This video isn't here to scare you. It's here to empower you. Because after 60, healthcare isn't just about catching problems early. It's about avoiding the problems we might unknowingly create. In the next few minutes, I'll walk you through the 5 most common medical tests that may carry hidden stroke risks, especially for older adults. But more importantly, I'll show you exactly how to protect yourself before your next appointment. So if you're over 60, drop a 1 in the comments. If you're under 60, type O, and stick around because chances are, someone you love needs to hear this too. And don't forget to subscribe to Senior Health Boost and hit that bell icon, so you never miss a video that puts your health first with real, honest answers no one else is sharing. Now, let's talk about the first test you should think twice about, especially if you've had it recently. If you've ever had a CT scan with contrast, you might remember that odd warm sensation flooding your chest or limbs, kind of like a heat wave rushing through your body. That's the contrast dye doing its job. It helps your doctor get a clear view of your blood vessels, organs, and soft tissues. Sounds helpful, right? Well, it can be. But here's what most seniors are never told. That little injection isn't just enhancing the image. It could also be stressing your cardiovascular system, especially if you're over 60 and already managing high blood pressure, heart conditions, or kidney problems. For some people, the dye triggers a vasovagal response, a sudden drop in both blood pressure and heart rate. This can lead to dizziness, nausea, fainting, or even temporary blackouts. But in other cases, the opposite happens. Blood pressure spikes rapidly. Fragile blood vessels can tighten or spasm under the pressure. And when that happens, the risk of a stroke or heart event increases quietly and often without warning. In fact, a study published in the Journal of Vascular and Interventional Radiology found that older adults who had contrast-enhanced CT scans had significantly higher rates of vascular complications within 72 hours, particularly those with existing hypertension, cardiovascular disease, or reduced kidney function. Simply put, the more vulnerable your system already is, the more stress this dye can place on it. Let me share a real case. An 81-year-old gentleman went in for a routine abdominal CT scan. He had been feeling some minor digestive discomfort, nothing urgent, just precautionary. The scan came back normal. He was reassured, sent home, and told everything looked fine. But 2 days later, he suffered a minor stroke. Why? The likely culprit was the contrast injection. It may have caused a temporary spike in blood pressure, which in turn led to a small clot forming and blocking blood flow to a part of his brain. Now, does this mean contrast CT scans are bad? Absolutely not. They're incredibly useful for detecting cancers, aneurysms, and serious blockages, sometimes even saving lives. But here's the key takeaway. It's not about avoiding the test. It's about knowing when and how to approach it safely. In the next section, I'll show you what questions to ask before undergoing a contrast scan, and we'll move on to the second medical test that carries stroke-related risks you've likely never been warned about. Let's keep going. We uncovered how one of the most common procedures, CT scans with contrast, can quietly stress the cardiovascular system, especially for adults over 60. While the scan itself can save lives, the contrast dye use can sometimes trigger dangerous blood pressure spikes, particularly if you already have heart, kidney, or vascular conditions. Now, let's talk about how to protect yourself before it happens. First things first, court scans with contrast should never be ordered just in case. They should be used wisely, only when the benefits clearly outweigh the risks. So how can you protect yourself the next time your doctor recommends one? It all starts with a few simple but powerful questions. Doctor, is this scan absolutely necessary for my diagnosis? Is there a safer option for someone my age and with my medical history? Would a non-contrast scan or an ultrasound provide enough information? These questions aren't confrontational. They're collaborative, and they give your healthcare team a chance to pause, reassess, and potentially choose a safer route. Be sure to share your complete medical history, especially if you have high blood pressure, kidney disease, heart conditions, previous allergic reactions to contrast dye, or if you're on medications that affect circulation or hydration. Also ask, can this be done without contrast? In many cases, the answer is yes. A non-contrast CT or ultrasound can provide the details your doctor needs without placing unnecessary stress on your cardiovascular system. Remember, it's not about refusing care. It's about personalizing care so that it fits your body, your risks, and your future. Now, let's move to the next test that's often presented as routine but can carry significant risks, especially for seniors. The stress test, a pressure test for your heart. And more, it sounds like a smart, proactive move. Strap on a heart monitor, hop on a treadmill, and let your doctor see how your heart performs under pressure. But if you're over 60, particularly if you have high blood pressure, a history of vascular issues, or any cardiac condition, this seemingly simple test can turn risky. Here's why. During a treadmill stress test, your heart is deliberately pushed to work harder and faster. As the speed increases, your heart rate climbs, your blood pressure surges, and your cardiovascular system is placed under intense demand. For a healthy 30-year-old, that's manageable. For someone in their 60s or 70s, especially with chronic conditions, it's like tossing gasoline on a low flame. In some cases, the body responds just fine, but in others, that stress can tip the system over the edge. Some of the real-world risks include dangerous spikes in blood pressure, a sudden onset of arrhythmias, irregular heartbeats, abnormal stress on the arteries, and, in rare but serious cases, small tears in fragile blood vessels, including those in the brain. Let's look at the research. A 2020 study published in the American Journal of Cardiology evaluated more than 1,300 patients aged 65 and older who underwent treadmill stress tests. The findings? Nearly 7% experienced adverse cardiovascular events during or shortly after the test, including sudden blood pressure surges, arrhythmias, and chest tightness. The group most at risk? You guessed it, those who already had vascular disease, hypertension, or a history of cardiac symptoms. And this isn't just something buried in medical journals. It's happening in real life. Take Margaret, one of our longtime viewers from Ohio. She's 74 years old, a retired teacher, and had been managing high blood pressure for years. Her doctor, hoping to stay ahead of any heart issues, recommended a routine stress test. Margaret agreed. Halfway through the treadmill portion, she started feeling lightheaded. Then came chest tightness. The medical team stopped the test immediately. She was monitored and sent home. But by the next morning, she suffered a minor stroke. Now, to be clear, the test didn't cause the stroke directly, but it introduced acute cardiovascular stress to an already vulnerable system, and that stress is what tipped the balance. Her blood pressure, already high, likely spiked even further during the test. Doctors now believe that rapid change ruptured a tiny vessel in her brain, leading to a mild but very real ischemic event. So what's the takeaway here? It's not that stress tests are bad. It's that they aren't one size fits all, especially after age 60. If your doctor recommends a treadmill stress test, here's what to ask. Is there a less intense way to assess my heart health? Can we consider a nuclear stress test that uses medication instead of exercise? Would a resting echocardiogram or cardiac MRI give you the same information without raising my risk? Also ask, am I experiencing symptoms like chest pain, fatigue, or shortness of breath? If not, you may want to question whether the test is needed right now or if it can wait. Because sometimes, the safest test is the one you don't take unless absolutely necessary. Now let's look at another routine procedure that becomes far more complex after age 60. The endoscopy, a closer look that's not always risk-free, whether it's a colonoscopy, an esophagogastrostomy, or any other internal scope. Endoscopy procedures have become a standard screening tool, especially for adults over 60. Doctors often recommend them as a preventive measure to catch things early, which makes sense in many cases. But here's what most people never hear. If the test isn't essential, and if it involves sedation, it could quietly introduce circulatory risk you didn't anticipate. Let's break this down. Most adults over 60 are on some form of medication, especially blood thinners like warfarin, aspirin, or Plavix. These medications are incredibly common and life-saving in the right context. But when combined with sedation, they can lead to serious complications. Sedation naturally lowers blood pressure. It slows heart rate. It temporarily alters how your body regulates blood flow. Add in anticoagulants, blood thinners, and you're increasing the chance of internal bleeding, oxygen deprivation, distortion in brain blood flow. And yes, transient ischemic attacks, TIAs, also known as mini strokes. In fact, a 2021 review published in Gastrointestinal Endoscopy examined outcomes for patients over 65 who underwent sedated endoscopy procedures. Their findings? There was a statistically significant increase in TIAs within 72 hours post-procedure. These weren't major strokes, but they were clear neurological warning signs indicating that something had gone wrong in the delicate balance of cerebral blood flow. And unfortunately, most patients didn't realize what had happened until days later, brushing off dizziness, fatigue, or momentary confusion as just part of recovery. So, what's the bottom line? If your doctor recommends an endoscopy, ask these 3 things. Is this procedure necessary right now, or are we doing it just to check a box? Will sedation be used, and if so, are there alternatives? Given my age and medications, how will we manage the risk of bleeding or blood pressure changes? In many cases, non-sedated options exist, or at least adjustments can be made to lower your risk before the procedure begins. You deserve to be part of that decision, not just informed afterward. Coming up next, we'll uncover another test that has become almost a routine and how the preparation for it, not just the procedure itself, can throw your blood pressure into dangerous territory if you're not careful. Let's pick up where we left off, talking about the risks of routine medical tests that can carry surprising consequences, especially for older adults. We just covered how sedation during procedures like endoscopy can silently stress a vulnerable body. Now, let's go even deeper into the risks you may face with another powerful but not always safe diagnostic tool, the MRI with contrast. We begin with a story that still echoes in my mind. A 76-year-old woman went in for what was supposed to be a simple, routine colonoscopy. She had no symptoms, none. It was just a standard check to be on the safe side. But 2 days after the procedure, her family noticed something was off. Her speech was slurred. She struggled to keep her balance. At the doctors confirmed what everyone feared. She had suffered a mild stroke. The likely cause? A drop in blood pressure from sedation, combined with her daily aspirin regimen. Together, those factors likely created the perfect environment for a clot to form and travel to her brain. Now, let's be clear, the colonoscopy itself wasn't inherently dangerous. But the combination of age, medication, and sedation, that's where the storm brews. So how can you protect yourself? The answer isn't to avoid endoscopies entirely. The answer is to ask better questions. If your doctor recommends one, don't just nod and schedule it. Ask, do I really need this right now? Especially if you're not showing symptoms. Many people get endoscopies just to be sure, but that just in case mindset may carry more risk than benefit. And don't forget your medications. Always inform your doctor about any blood thinners you're taking, warfarin, aspirin, Plavix, anything. Ask them, will I need to stop this before the procedure? Or what are the specific sedation risks for someone like me? In some cases, lighter sedation options or even sedation-free procedures are possible. But unless you speak up, those alternatives won't even be discussed. From your gut, we now shift focus to something that might seem unrelated but is deeply connected to your overall health: your kidneys. MRIs have revolutionized modern medicine. They give doctors an unparalleled view inside the body without surgery, without radiation. But when contrast dye is used to enhance those images, that's when we enter a danger zone. For seniors, this risk isn't abstract, it's personal. You see, the dye used in MRI scans often contains gadolinium, a heavy metal compound. In a healthy adult, this substance is filtered out by the kidneys relatively quickly. But here's the problem. After age 60, your kidneys may not be working as efficiently. And you might not even know it. That was the case for Harold, a 79-year-old veteran from Arizona. He had struggled with persistent back pain. His doctor recommended an MRI with contrast to rule out disc issues. Harold had no clue he had stage 3 kidney disease. No one tested his kidney function before the scan. 2 days later, he felt dizzy, foggy, and weak. These symptoms didn't go away for a week. When he finally saw his primary care physician, a simple blood test confirmed the issue. His kidneys were struggling and had likely retained some of that gadolinium. And that's the point most people miss. Gadolinium doesn't always exit the body quickly. In fact, it can linger in small amounts, especially in those with reduced kidney function. Over time, retained gadolinium has been linked to nephrogenic systemic fibrosis (NSF), a rare but serious condition where skin and connective tissues harden, limiting movement and, in severe cases, affecting organs. But the story doesn't end there. In recent years, retained gadolinium has also been discovered in brain tissue. Some scientists now believe this may explain subtle neurological symptoms that arise in older adults following a contrast MRI, things like confusion, dizziness, memory lapses, and balance issues. While not every case results in a full-blown stroke, these red flags should not be ignored. A 2019 study published in Radiology followed over 2,000 patients above the age of 65 who underwent contrast-enhanced MRIs. Within a week of their scans, about 5% reported stroke-like symptoms: blurred vision, vertigo, headaches, and trouble walking. Many of those patients had either undiagnosed or unmanaged kidney issues. This begs the question, is contrast always necessary? Often, it's not. If your doctor recommends a contrast MRI, here are 3 things you must do before saying yes. 1. Ask if the scan can be done without contrast. In many cases, the answer is yes. 2. Request a kidney function test. It's called a GFR, glomerular filtration rate. It's a simple blood test that tells your doctor how well your kidneys are filtering waste. 3. Report any strange reactions from past imaging tests. Dizziness, nausea, fogginess, these are not trivial side effects. They may be signs that your body didn't process the dye well. And remember, it's not the MRI itself that's risky, it's the added chemicals your aging body may not eliminate as easily. Now, let's take a step back. We've talked about colonoscopies, stress tests, MRIs, all routine procedures meant to help, but with real risks for the aging body. These aren't one-size-fits-all solutions. And yet, too often, they're prescribed like they are. It's easy to feel like a number in the healthcare system, just another senior being shuffled from test to test. But the truth is, you have the power to ask questions, to understand what's going into your body, and to advocate for your unique needs. Because you're not a chart, you're not a scan. You're a person with a lifetime of experience, and your health deserves more than default decisions. And that brings us to a procedure that might surprise you. It's something that seems completely safe, even smart to do regularly. But in reality, it may be pushing older adults towards surgeries they never truly needed in the first place. We'll explore that test, one that often leads to unnecessary interventions, on the next page. So, take a deep breath, maybe jot down a question you want to ask your doctor, and when you're ready, let's move on together to uncover the next hidden risk you need to know about. Let's take a moment to revisit what we've uncovered so far. From CT scans with contrast, to treadmill stress tests, sedated endoscopies, and even MRI scans with gadolinium dye, each of these routine procedures, while often well-intentioned, can carry unexpected risks for seniors, particularly when performed without the right precautions. And now, we come to the final test on our list, one that appears completely harmless at first glance, but could steer you toward risky and unnecessary interventions: the carotid artery ultrasound. This test is quick, painless, and doesn't require needles, dyes, or loud machines. It uses sound waves to check for blockages or narrowing in your carotid arteries, the main vessels that supply blood to your brain. Sounds like a smart idea, right? Especially after 60, when we all want to be a little more cautious. But here's where it gets complicated. If you don't have any symptoms, if you're not dizzy, not having vision changes, not feeling weakness or confusion, this scan might do more harm than good. Why? Because discovering even moderate plaque buildup can start a domino effect. Imagine this. Your ultrasound shows a 50 or 60% narrowing. It sounds scary. Your doctor refers you to a vascular surgeon. Suddenly, you're being told you might need a procedure like a carotid endarterectomy or stent placement despite having no symptoms at all. The truth is, mild to moderate narrowing is extremely common in older adults. And not all of it needs to be treated aggressively. In fact, in many cases, it is safer to manage with medications and lifestyle changes rather than jumping into surgery. A major study published in the New England Journal of Medicine tracked more than 3,000 seniors who had moderate carotid artery narrowing but no symptoms. The results? Those who went straight to surgery did not significantly reduce their risk of stroke compared to those who took a more conservative approach. Even more alarming, a small percentage of patients actually experienced strokes because of the surgery itself, either during the operation or in the recovery period. Let me share a real-life example that brings this into focus. Helen, an 82-year-old woman from Pennsylvania, felt perfectly healthy. No dizziness, no headaches, no symptoms at all. Her doctor, just trying to be thorough, ordered a carotid ultrasound during her annual checkup. It showed 65% narrowing. She was immediately referred for a procedure. But during surgery, something went wrong. She suffered a mild stroke on the operating table and now lives with partial weakness on her right side. Helen told us, "If I had known, doing nothing might have been safer. I would have waited." That's the key, understanding when action is needed and when watchful waiting is the smarter move. So, what can you do to avoid unnecessary procedures? First, if your doctor suggests a carotid artery ultrasound and you're not having symptoms, ask a few simple but powerful questions. What are we looking for exactly? If we find narrowing, what will we do about it? Will this test actually change my treatment? If the answer is vague or non-committal, it may be worth hitting pause. Because tests should never be performed just for the sake of testing. They should be done when the outcome will directly affect your care plan. Second, if you've already had a scan that showed some narrowing, don't panic. In most cases, doctors can monitor the condition over time with follow-up scans and help manage your risk with medications like statins, blood pressure pills, and aspirin if needed. Many patients live decades with mild to moderate narrowing and never experience a stroke. What matters is your overall risk profile, not just a number on a screen. And third, if surgery is ever recommended, especially for something you didn't even know was a problem, don't be afraid to get a second opinion. A vascular specialist, or even a stroke prevention clinic, can provide insights into whether the benefits of the procedure truly outweigh the risks in your case. Now, as we bring this journey to a close, let's take a step back. You've learned that not every medical test is bad, but not every test is necessary either. Especially after 60, our bodies respond differently. What used to be routine can sometimes carry unintended consequences. A simple scan might spike your blood pressure. A contrast dye might strain your kidneys. Sedation might disrupt your circulation. And a well-meaning checkup might steer you toward a surgery that changes your life forever. That's why it matters so much to ask questions, to speak up, to be informed. Because when you understand the risks, you can make smarter choices, ask better questions, and ultimately protect your health more effectively. Here at Senior Health Boost, we believe in empowering you with knowledge. Real, unfiltered, science-backed information that puts you in the driver's seat of your own well-being. Because your voice matters, your story matters, and you deserve care that's personalized, respectful, and safe. So if this video opened your eyes, if it made you think twice before your next checkup, or reminded you that you have the power to say no or ask for alternatives, then let us know in the comments. Drop a 1 if you've ever experienced a test that left you with more questions than answers. Drop a 0 if you haven't, but you're grateful to be aware now. And before you go, make sure to hit that like button. If you found this valuable, share it with someone you care about, a parent, a friend, a neighbor who might be facing similar decisions. And most importantly, subscribe to Senior Health Boost. Because we're here every week to bring you the truths others won't tell you, the questions doctors sometimes forget to ask, and the tools you need to age with strength, clarity, and confidence. Thanks for watching. And remember, your health isn't just about tests, it's about choices. Let's make them wisely, together.